Hello parents, this is Dr. Lakshmi from Little Ones Pediatric Clinic, back again on Little Ones Wellness, this time with a short session on breastfeeding. I'm not going to bore you with the whys and hows of breastfeeding. Every mother out there is familiar with these concepts. I just thought I'd address a few FAQs I encounter in my practice. So the first question is, how do I know my feed is sufficient for my baby? Now, if your baby has 6 to 8 wet nappies in 24 hours, feeds say 8 to 12 times a day and looks happy, content after each feed, sleeps well and is gaining weight at a constant steady pace, we know that your feed is sufficient. Now the second question is, do I feed on the same side during a session or do I alternate both breasts during each session? Now this actually depends on the preference, convenience and comfort of both the mother and the baby. Yes, professional advice in the first few weeks after birth would be to feed on both breasts during each feeding session. Now this promotes milk letdown and secretion. It avoids unnecessary problems like breast engorgement, plugging of the milk ducts and mastitis, which is infection. After 4 to 6 weeks, when your milk production has been established well, your baby is feeding well and is gaining weight, you follow your baby's lead, follow your baby's cues. Offer her one breast. Once she is done feeding, put her on your shoulder, pat her back, burp her, change her diaper and offer her the other breast. Now, if she nurses on the other side too, continue feeding and once she's done, repeat the same cycle and put her down. There are certain special circumstances where we do advise feeding on one side. This is when you have an overabundant milk production on one side, or you have certain medical conditions involving the breast or the nipple that makes feeding on that side difficult. In certain instances of foremilk hind milk imbalance, we advise feeding on one side to completely empty out that breast. This reduces the incidence of fussiness, gassiness, crankiness and green frothy stools, colic in your baby. Now coming to the third question. My baby is on a breastfeeding strike. What do I do? A breastfeeding strike or nursing strike is very common. A baby who's been feeding very well suddenly decides to stop feeding out of the blue. This causes a great deal of anxiety, tension and guilt in the mother. First, you need to understand the possible causes of a nursing strike. It could be pain or discomfort, teething, a cold sore, oral thrush, a ear infection maybe, transient fussiness after a vaccination visit because of discomfort at the injection site, an illness, a cold or stuffy nose, your baby is uncomfortable and doesn't feed well, stress and distraction. See, overstimulation and delayed feeding can frustrate your baby. Remember that. Unusual scents and smells. See, a new deodorant, a new perfume, a change of soap, an unusually pungent food. That can trigger a nursing strike. Certain medications prescribed to the mother too. Finally, reduced milk production. Now this could be because of reduced milk secretion per se or overuse of a pacifier. Now, how do you deal with a breastfeeding strike? You will have to continue feeding at any cost. So keep trying. Try and try. Change positions when you're feeding. Cuddle your baby often. Minimize distractions. Take your baby to a cool, quiet room and feed her there. Of course, you will need to meet your pediatrician if such a strike lasts for more than a few days and you are concerned about fewer soiled wet diapers or you're concerned about weight gain. So that's about it for now. Until next time, happy parenting.